Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and to give us a 5-star rating on iTunes to continue hustling. This episode is sponsored by Imaging Services, Chiro Health USA, Chiro Moguls, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, New Patients in a Box, the Influencer Authority Podcast Training, Mango Voice, Community Healthcare Resources, Life Chiropractic College West, TrackStat, and M-Sculpt. Let's hustle.
Hey guys, welcome to episode 447 of the Chiro Hustle podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we have the opportunity of interviewing Dr. Clint Steele, and if you want to hear about chiropractic truth tellers, stay tuned. Welcome back. This is another episode of the Chiro Hustle podcast. Yeah, Clint.
Yeah, baby. Let's do this.
I know, right? It's 447th episode. I looked back, and the first time that we actually had an episode of you was episode 80.
Dude, I know, and I'm telling you, that's way too long between episodes, man. You got to get me in at least every 100. So 80s, 100 and something, 200 and something, 300 and something. Dude, this is way too long.
Yeah, it's been a long time coming, and I'm really thankful. But I have noticed that you've been up to some really great things, and you now have a magazine that you've been doing. But before we jump into talking about that, I just want to set the ground level for people so we can build on top of that and let people know our big why. Why do we do what we do? I don't think I was doing this last time I interviewed you, but I've gotten a lot more serious with our approach.
Uh-oh.
And yeah,
look out, man.
But I think you'd appreciate it because when I open, I tell people the big why. Well, we protect freedom of speech, and it's particularly medical freedom of speech. And we let the people that we interview speak freely about what makes them unique and what makes chiropractic such a beautiful and powerful profession. And I think we're going to be able to have a great conversation today. Historically, we've always had Luke on the show, so you've probably been interviewed by my co-partner and I. Sometimes I've interviewed you in person. I think this is our 4th or 5th interview, but we also tell people that we protect the sacred trust. And I think that we weren't mentioning that before either. So I've learned that what really matters to chiropractic is protecting the foundation and the fundamentals. And, it's remembering those things and building off that historical context for people to know where we are today because of that. So it was BJ's Palmer's last words where he said, for I give you a sacred trust, guard it well. And I always tell people to go to your favorite search engine and find out what that is and look up BJ Palmer and Sacred Trust, and you'll know more about chiropractic than you ever knew before.
That's right.
And then I tell them that we support subluxation-based chiropractic, which, sometimes people don't know what that means either. So look up the word subluxation, and that's what chiropractors check in your spine and correct with their hands. And that's really important for people to know too. So, I mean, if I don't answer these early things for people, they might not understand the context of where we're going today and why the work that you're doing matters so much. And then we also do believe in universal intelligence and innate intelligence, and that when somebody gets adjusted, it connects the physical person to the spiritual person, which is kind of woo-woo in some people's minds, but until you get adjusted, you don't know. Absolutely. So episode 447, Dr. Clint Steele, welcome to the show, man.
Dude, thanks for having me, man. Let's rock this thing.
Yeah, so tell us about it. This path you're on. I've seen you just everywhere.
This path that I'm on is about saving lives, man. People are dying out there because they don't know the truth behind chiropractic. It's really as simple as that. I'm not going to water it down. I'm not going to dumb it down. People are dying right now in communities all around this country and all around this world because they don't know what chiropractic is, okay? They think it's about neck and low back pain. And as you just talked about, sacred trust and subluxation, it's so much more than just about neck and low back pain. And us as chiropractors, have to know that first up here in our heads, our own heads, and then we have to be able to explain that to our communities and to our patients, and then we got to be able to care for that. Because going back to what you said is, removing the subluxation is about improving brain function. The cause of over 90% of all disease is the inability for the brain and nervous system to adapt to and recover from stress. So that's how we tie this all together, man. The chiropractic adjustment saves lives. Period. End of discussion.
And
so how's that for a start?
Yeah. And as many people know, when I jump out and I go and do chiropractic marketing events, I pull some old Sid Williams lines out, and I tell them that you don't have to believe in chiropractic with my keys. And I drop the keys, and
Exactly,
I tell them that it works whether you believe it or not. I tell them it's not a belief system. You don't have to believe in it, because sometimes people come by and tap me on the shoulder and be like, you know what? I really believe in chiropractic.
Yeah, I hear it all the time, man. like what is there to believe in? I mean, you just ask the very simple question: what coordinates every function in your entire body? Everyone knows the answer. It's the brain. But even up higher than that, like what took two cells and brought them together, and like 9 months later, we have a fully functioning human being, right? There's some higher power. You're talking about universal intelligence and innate, right? That's it. That's what we're doing here as chiropractors. Chiropractic, I'm talking about health here a lot, but chiropractic is about so much more than just healthcare. This is about life care, right? This is about improving people's lives, not only their health, but their relationships and their careers and their finances and their outlook on their entire life. It all comes back to the brain and nervous system, and higher than that is innate intelligence, and the entry point is the brain and nervous system.
Yeah, I love how you change the pain game to the brain game. And I think that it's really important for people to understand that the top of the spinal cord is the brain.
Yeah.
And a lot of times people just kind of think it's like vertebrae housing the spinal cord, which is true. But there's also this amazing thing that happens up, in our head, and it has all of our motor skills and all of our thought processes. And so many times people don't understand that as you have that poster over your shoulder with the thoughts, traumas, and toxins, a lot of that starts in the brain.
Well, here's the thing. First off, obviously thoughts start in the brain, right? So one of the things that a lot of people don't understand is that your thoughts actually change brain function. If you're focused on negative thoughts, it's going to increase. And we test this with our instrumentation. It increases beta waves. It lowers theta waves. High beta waves make you overreactive. It makes you think that the fire alarm is going off all the time, in which case your brain is going to send certain messages to your body to send chemicals out to help you escape a burning building, or to get into a fight, right? Or to flee a situation, right? Fight, flight. Basically, that's what we're talking about. And so it all starts with thoughts. But again, chemicals, same thing. You can eat sugar. Boom, we've got science that proves that, hey, sugar affects brain function immediately, right? And then obviously we've got trauma. We're not talking not only head trauma. We're talking, you take a fall, you injure your shoulder, you have reduced range of motion in your shoulder or in your back or in your hip or in your knee. Is that affecting brain function? And the answer is absolutely, because what moves that knee? The brain. In order for that knee to move, the brain has to be able to communicate. So if the communication is not going back and the range of motion is not there, it's going to affect brain function. That's going to affect the output, right? So poor input equals poor output. It all comes together, right? And so what we do is when we correct subluxations, we're actually affecting brain function. And when we improve brain function, now that person can perceive the environment better. They can make better decisions. Okay, they improve their health. They improve, again, like I said earlier, their relationships, their career, their finances, because now they can make decisions based on the facts instead of this irrational decision making based on, oh, I got to escape this burning building first. Like I can't worry about this. I've got to escape, right? And that's what happens when you get imbalanced brain function, right? Which is from obviously subluxations, right?
Yeah, and as I've interviewed over 1,100 chiropractors in the past 5 years, I realized that so many times there's an approach, but it always goes back to nervous system correction or vertebral subluxation and outcomes, and getting people better. And I think that that's been something that since I've gotten to know you, that's always been like the method. Like, let's find the people, let's help more people, let's get them into, either my clinic or someone else's clinic, and let's get them checked, and let's get them under care. And I think a huge part of our early conversations were based around high PVA and getting people to stay under chiropractic care, because as we say, it should be from first breath to last breath, and people should be under care from cradle to grave. And these are like, themes that I talk about all the time, but it never gets old. And it's always something that people can like really rely on for like fundamentals of chiropractic, to know that it's not just the one-time miracle adjustment that you go get. It's the continuous care that you get for you and your family, and to make sure that people aren't in this fight or flight, number one, and to make sure that people's nervous systems are chilled out so they can adapt. And I like the thing that I learned a long time ago, that if we don't tell them the truth about chiropractic, someone else will close them for a pharmaceutical product, or they will convince them that they need to have some irreversible surgery.
Yeah,
and chiropractic is that answer. And that's why I've been banging the drum for so long, telling people about what's going on. But, I also love that you're measuring this, you're measuring outcomes. And I think you use the NeuroInfiniti. Am I correct?
Yeah, we have a couple different ways to measure brain function. But going back to earlier what you said, I want to talk about this, because you talked about, earlier discussions were high retention, like regular chiropractic adjustments for a lifetime, from birth till death. And one of the things that one of my associates used to say all the time was, the best chiropractic testimonial is the one that never happens. It's the one where the mom's getting adjusted through the birth process, during their pregnancy, the baby gets adjusted, right away, and then through their life, and they never sick. They're never sick, right? They never have to go on a medication. They never have to have surgery. Those are the best chiropractic testimonials, right? Mm-hmm. But ultimately, going back to the next thing you talked about was, it comes back to brain function and brain and nervous system. If you ask 100 chiropractors what body system ultimately is chiropractic about, 100 of them are going to say the nervous system, right? But yet, if you go out and you ask the public, you ask 100 people in the public what chiropractic is about, what are 99 of them going to say? Neck and low back pain, right? So there's an incongruency there. And part of the reason is because we don't actually measure, well, I shouldn't say we, because I do, and a lot of my colleagues do now, but most chiropractors don't actually measure brain and nervous system function. They'll measure where a subluxation is, which is great. Fine. Let's take x-rays. Let's do, whatever we need to do. But in addition, let's actually see what's going on with the brain and nervous system, which we can do in our practices in either a 6-minute unattended, non-invasive assessment or 12-minute assessment. We can actually see what's going on with the brain. And so when we start performing our adjustments and we start, progressing through our care plan, we have patients now that can actually see that their brain function is improving, right? Which is huge.
So what systems are you using to test and get these objective measures?
So one is called the NeuroInfiniti, which is a 12-minute assessment. It actually is an EEG, so it measures not only brain waves, but at the exact same time, it measures heart rate variability, heart rate, respiration rate, skin conductance, hand temperature, and muscle tension in the traps. But most importantly, what it does, Jim, is it measures during stress, in fact, 4 different types of stressors, and then 4 different recovery periods. So I always ask the question to docs, listen, someone comes in and their heart rate is 66 beats per minute. You're going to say, okay, they have a pretty healthy heart, right? But let's say the fire alarm goes off. What should happen to their heart rate?
Go up.
And if it doesn't, is that a problem?
Yeah.
Yeah, because they can't escape the burning building, right? On the other hand, let's say it's false alarm, their heart rate does go up, but then afterwards they come back in, it's false alarm, 10 or 15 minutes later, what should happen to their heart rate now?
Should lower down.
And if it doesn't, is that a problem?
Of course.
It's called adaptability, right? This is the power of the brain and nervous system, the ability to perceive the environment and then adapt to whatever that environment is. The problem comes in is if we get to the point where, let's say our brain can handle this much stress, but our stress levels are up here. What is the ability for our brain and nervous system to handle and coordinate the functions in our body if their stress levels are here? it's not happening like it should, right? It's messed up.
There's
And so
disconnect. There's a
there's a
disconnect.
disconnect. And that's what happens is in fact, we've got probably about 90% of the public today, especially since COVID, about 90% of the public today that cannot adapt properly, okay, because of too high of stress levels.
Well, I think they're stuck in an open loop of fear.
Totally.
And they don't know how
man.
they don't know how to complete this cycle of action with like homeostasis again. They're so far out on one far direction that bringing them back to a baseline center, like they're still thinking that the world's going to end.
And that's totally true. And this is what happens though, is this pattern gets set up and then it becomes a habitual pattern. Okay. And so it usually starts at birth. Actually, it starts at conception because the mom usually passes that down to the baby while the baby's in the womb, okay, in utero. So what do you think has happened to all those babies that were going through, that were in their mom's womb during COVID and just after COVID?
Massive cycles of stress.
And this is what we're seeing now. We're seeing kids that are growing up that are unbelievably sick.
And the cortisol is so out of control inside of these moms while they're like you said, in your utero, they're carrying this child and they're like at peak level stress like they've never experienced in their life.
Yeah. We're going to start seeing a term and I just watch for it. It's called transgenerational stress. Okay. And you're going to see, so chiropractors are starting to talk about it now, but what you're going to start seeing is you're going to start seeing the medical profession start talking about transgenerational stress. And basically what they're starting to see is that this stress from the mom while the baby's in the womb is being passed on. Okay. And it can't change unless you intentionally change it. And that's where chiropractic has to come in, because we're the leaders. We're the leaders in helping the brain and nervous system adapt and being able to change these patterns. But in order to change these patterns, we've got to measure it first. We've got to be able to prove it to ourselves, to the patient, and then we've got to be able to track it.
Well, people have been saying this for a long time. Oh, it's hereditary. I just have it in my genes.
Yeah, different way though. different way.
But they've been saying that forever. Like, how are you diabetic? Oh, it just runs in the family.
Yeah.
You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is sponsored by Imaging Services, Chiro Health USA, Chiro Moguls, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, New Patients in a Box, the Influencer Authority Podcast Training, Mango Voice, Community Healthcare Resources, Life Chiropractic College West, TrackStat, and mSculpt. Let's hustle.
Yeah, but as we know, stress has to turn that on, or the environment has to turn those genes on, right?
Yeah, that's why, the work that Bruce Lipton has done is fascinating, because I do believe that whatever environment that we live in and that how we take care of ourselves with our behaviors and habits, that's who we become. And if you allow yourself to be in this open loop of stress and you don't have regular chiropractic in your life and you're not practicing that type of rebalancing and that clearing out and that recentering of your nervous system, you don't even know what good health is.
Totally. That's what, and unfortunately, that's what most people are walking around, right? They think they're healthy because their symptoms are under control or they don't have any symptoms, but they have no idea what peak health is like.
And they shouldn't be making critical decisions.
Totally.
Like, we don't need anybody subluxated out there that's making important decisions for other people.
That's totally true, man. But it goes back to what we were talking about earlier was the lifetime care, right? So this is why it's so important, because when is stress going to stop? When we're dead, right?
Yeah.
Stress doesn't stop until we're dead. And so we've got to always make sure that our brain and nervous system can adapt to the stressors. And when we go through big life, I mean, we've got a list, we've got psychology that goes back, probably 50, 60 years of we know the most stressful periods of time in our life. When we go through a big move, when we go through a divorce, when we go through, a wedding or a divorce, any of that stuff, like they're all top 30 or 40 things. right? Those happen all the time. But in addition to that, we have the little stressors too that keep adding up, adding up, adding up. And when our brain can't take it anymore, we can't adapt anymore, man, we're screwed. We are screwed.
Well, I think the people have to really recalibrate how they think about day-to-day life. And for a long time, I'm just being honest, like I thought they're gonna like wouldn't go to let me go to the grocery store anymore. I thought they weren't gonna let me in because I'm like, I'm not gonna do what you guys want me to do. Like I'm here to get food. I'm not here to play.
I'm sneaking my way into the grocery store. How can I sneak into the grocery store, man?
I didn't think they were gonna let me in anymore. And that's what I was telling you, like before the interview started, hygiene theater. Like they made us all play this like really strange like hygiene theater game where we had to prove to other people that we're subluxated, that we're fine and healthy and capable, but we had to prove to all these people that have no idea what real health is. Yep. And we have to like, walk in line and say, okay, I'll just put this little thing on, just to be able to go to get groceries. But they really had us all playing this game of like proving that we fit in with this sick model. And that's the thing is, I think really I was talking to a gal that does personal branding yesterday. And I was like, look, if we could fix the thing on a political level to where people would be supportive of chiropractic, like the world of politics would support chiropractic like full on, there wouldn't be enough chiropractors. And to take the flux of 90% of people that aren't seeing a chiropractor and say, hey, go see the chiropractor now, we would have to like systematically deploy 10,000 chiropractors over the next 5 years to fit the demand.
I've been saying that to docs for a long time. If more docs would actually start focusing instead of on pain and focus on the brain and nervous system and explode their practices like I did. I went from 0 to 500 patient visits a week in 6 months, 100% cash with zero advertising, right? I started with $1,000, 750 square foot office space. If docs would do that, if they would focus on the brain and nervous system instead of thinking that
everything needs to come based on pain, man, we wouldn't have enough chiropractors. We wouldn't. I think if I could just be like honest and humble, is the chiropractic profession needs to find more unity with each other, and they need to learn how to lobby a lot stronger when it comes to play in that arena. And I think that what you're doing with this magazine could position chiropractic a lot like stronger from a public's perspective.
Well, that would be awesome, man. And I hope it does. But yeah, that's all part of our movement, man. We need, my opinion is this, you're talking about lobbyists and you're talking about political, stuff. And yeah, absolutely. But I think it starts at a more foundational level than that. I think it starts at a grassroots level, because as a grassroots starts to increase and more people become aware and know the truth behind chiropractic and what chiropractic actually is, then we get politicians that are knowing better. They're going into their offices, knowing what chiropractic is. And so when they hear from the pharmaceutical lobbyists, this is crap, you're feeding me a bunch of crap. And sure, some of them are still going to take the money and do whatever, but some of them still are going to say, listen, that's crap. And I've got chiropractors here behind me and I know the truth behind health, and I know the truth. And I believe that's when things are going to really start to change.
Well, I don't think anybody in those big political decision maker jobs really want to see people more sick. I was talking to somebody earlier about like the world of doctoring, and we were talking about like outcomes. And I think that if the people that were doing all the prescribing knew that chiropractic was such a wonderful profession that could help more people, they would be ushering people over to the chiropractic side constantly. But they've been in a dogmatic scene where they've been taught a certain way that they believe that there's only one way, but they don't study the numbers. Here, how you're talking about re-regulating and retesting and recalibrating the brain. Well, we need to also recalibrate and retest and see how miserably we're failing as a nation on health scores and health outcomes, and where our state is of obesity and metabolic syndrome and these things. And I do think that if people start becoming more chiropractic case driven as a whole, like population, like you're saying, these neighborhoods and these families, we'd have a whole different outlook, and we wouldn't have the same conversation a year from now, Clint.
Totally. I totally 100% agree, man. And we need to change it. And so that's why, I'm on my mission is to help more chiropractors, because every chiropractor knows that chiropractic is about the brain and nervous system. But again, when I ask them, then what are the majority of patients seeing you for? The majority of them say, well, back pain or neck pain or headaches.
Well,
Okay,
we need to start a take a chiropractor to lunch program where people in their towns that are dual chiropractors or multiple chiropractors, we got to start a take a chiropractor to lunch like group, so people start to get to know their brothers and sisters that are practicing, in the same cities as them, so they can start building a unified front rather than saying, oh, they do it different over there, you might not want to go over and see them. And I think that there has to be a lot more, cross referral, cross appreciation, cross support within the profession. And I think that would help a lot too.
I think you make some good points there, especially, we see, for example, if you got a chiropractor that focuses on pediatrics and you got another chiropractor in town that focuses on, sports injuries. Let's cross referral. I think what happens is a lot of chiropractors try to be the end all be all for everybody, which again, if we're talking brain and nervous system function, improving that, obviously we can improve that with everybody, but then we get into some specifics, and some specific niches that we can absolutely do that. But great point. More chiropractors and communities need to come together. And I as soon as you said that, I'm like, you know what? I need to do that in my community, man, and get together and unify the front. And we start promoting chiropractic and the truth of chiropractic in our communities, absolutely.
So let's talk about the True Chiro magazine. I know I've mentioned that a couple of times during our chat today, but I know it's intended to save more lives and to get more truth out about chiropractic. But what do you see happening with this 3 to 5 years from now?
3 to 5 years from now, this is going to be worldwide. We're going to see this in not only every chiropractor's hands, but we're going to see it in all their patients' hands, and they're going to be reading it, and they're going to be, basically saying, oh my gosh, I had no idea this is what chiropractic was about, and I've been going down the wrong lane, and I need to get off this medication. And because it's logical, the first issue came out, and the feedback that we're getting from docs is, oh my gosh, this is like, so it makes so much sense, right? Because when you think about the chiropractic principles and you think about the foundation of chiropractic, it's so basic, right? It's like, hello, the power that made you can heal you, right? We just have to remove the interference. We've got to, and what that means basically is we've got to get the brain and nervous system be able to adapt to and recover from stress. That's what we're talking about ultimately. And when you do that, like if the same power made you, it took 2 cells and made you into a human being, why can't it help your high blood pressure? Why can't it help your digestive problem? Why can't it help your immune system problem? It can. We just got to be able to remove that interference. We've got to improve that adaptability. And then, in some cases, if someone has something removed or they're, in the minority of cases, something, extreme, we've got to take some extra measures. But in most cases, that's what it is. And so in 3 to 5 years, I want the majority of chiropractors to be at their capacity, and we need more chiropractors. We need more chiropractic schools. We just need more, right?
Yeah. So let's talk about your path a little bit. Since I met you 2019, 2018 areas, you've been traveling a lot, man. Where are some of the places that you've gone that you've really enjoyed this past year?
Well, I want to go to Mexico. Hint. We went, man, we were all over the place, man. In fact, the last probably couple months we were in, I think in like 3 weeks period of time, I was in Boise, Idaho, which was amazing. You've been in Boise, man. Boise's awesome. I was in Burbank, California. I was in Salt Lake City. I was in Dallas. I was in Denver. I'm thinking somewhere else.
I can't keep up with you, man.
Then I was in Nashville. Then I was back in Dallas. We're going to Atlanta next week. And then I'm going to be in Little Rock, Arkansas, man. So I was just asked to speak in Little Rock. I want to go to Alaska, though. Next time you go to Alaska, dude, count me in. I want to go. And I want to go to Mexico. And anyone out there, we have docs out there that are wanting us to come to to London, to Australia. So
Hey,
sign me up, man.
Sign me up with you.
All right, let's do it. Let's do it.
The Hustle Truth Tour.
Yeah, let's do it, man.
Yeah, well, I think it's been really a great chat about all things chiropractic today. And I'm really excited that you were on for episode 447. Is there anything that I didn't mention to you that you think we should share with our audience today before we call it a day?
That I don't have any hair. Did you know that, man?
You do a good job.
Yeah. No, just, I tend to get excited in these interviews, man, and I get all pumped up. But ultimately, guys, what it comes down to is this: and whether you're a chiropractor watching this or you're in the general public, watching this, ultimately, first off to you, man, hats off to you, man, because you're doing an amazing job getting the word out and hustling, right? And so you were complimenting before we started, and I said, well, I'm just following your lead, man. I'm out hustling like you are, and that's what we need more of. But ultimately, here's the thing: is people are dying right now because they don't know the truth. They think that the only thing that can save them is a medication or a surgery, and that's not the truth. That's not the truth. And so that doesn't need to be happening anymore. And so we need more chiropractors out sharing the truth. Be bold. Okay. Don't be afraid. Don't be afraid, because at one point I was afraid to say I was a chiropractor because, I thought medical doctors were up here. I thought, other people were up here, and that's not the case, man. Chiropractic is the most amazing profession on this planet. Right. And when we focus on doing what we do, which is improve brain and nervous system function, there is not one disease out there that cannot be reversed. None, zero, none. And I'm not claiming that I can fix anything or anyone. I'm claiming that I can fix the brain and nervous system. And when the brain and nervous system is working better, innate can take over and do what it does. And that is where the power really lies. Right. And so everything can be reversed. And so whether you're a chiropractor or you're watching this from the general public, know that you can reverse this. You can change this. You can improve not only your health, but your life, everything.
Well, Dr. Clint Steele, I feel like, and I know this, if you're the last chiropractor on planet Earth, the profession would survive.
Thanks, brother. I appreciate you, man. I'm going to be recruiting everyone. First thing, you're going to become a DC. You're going to school with me. You're coming to DC, right?
Well, thanks for sharing, man. And you are right. If everybody knew the real truth about what this profession could do for them, they wouldn't live in the dark ages anymore. They would step into the chiropractic ages, and they live a subluxation free life, and they probably make a better quality future for themselves. And,
Absolutely.
We don't want to guess with our health. And that's what I love about chiropractic is it's very scientific. As people this past couple of years be like, we want more scientific stuff. Well, chiropractic is definitely scientific, and it helps with people's quality of lives. And I think that as we develop more and more content going forward, I look forward to what you're doing with your magazine, and we'll make sure that we don't jump another 200 or 300 episodes without getting you on here.
If the next time I'm on, it's 800 and something, dude, I'm going to be pissed. I'm just telling you right now. It better be in the 500s, man.
Well, Dr. Clint, enjoy Portland, Maine this evening. And thank you for being on for 447.
Enjoy Grand Junction, Colorado, man.
Dude, it's beautiful out here.
It's awesome there.
It's good weather right now, and it's right there before the winter's coming. So
I don't know if I told you, I almost went to Mesa.
Oh, really?
Yeah, I ended up going to Durango. Yeah, I ended up going to Fort Lewis instead. But
Durango's a nice place.
Yeah, it's beautiful. Yeah.
Yeah. Well, we're gonna close out today, telling you guys you're just one story away. Keep hustling, and watch out for this guy. But before we close, where can they find this magazine? I forgot to ask you.
So send us we're sending it out to all licensed chiropractors in every state right now. So they're still going out right now. But if you want to make sure you get yours, just message me or message you their address, or you can find me. Our Facebook group is Chiropractic Truth Tellers. Make sure you get in there because we share a ton of value in there. But you can interact with us, and we can get your or I'm on Facebook too. Just message me your address, and we'll get you.
What's the website?
TRUCHIRO.org. TRUCHIRO.org.
There you go. Go over, check it out. Chiropractic Truth Tellers on Facebook. Friend request Clint Steele, and go to TRUCHIRO.org and make sure you get this magazine. Love and appreciate you, brother.
Thanks, brother. Love you,
Talk
man.
soon. Bye.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.